Hi there, my name is Navida Dolopo. I'm a licensed acupuncturist, and today I'm going to present to you my 105th video for my practice, Elements in Harmony Acupuncture and Chinese Herbs. The name of my website is elementsinharmonyacupuncture.com. This is my 13th fertility video. This video is specifically going to talk about Anna's fertility program. This is a very unique program to any other program out there. This is not for everyone. You need to be a patient for at least 20 treatments. I will consider if it's at least 10 treatments, if we do a follow-up and discuss things, but it really needs to be at least 20 treatments. At 20 treatments, you should know by then if this is something that you really want to invest in. Up until 20 treatments, or potentially 10, depending on your level of aggressiveness and the number of treatments, the frequency, the intensity, how long you're willing to stay during the treatments. Once we start on the program, there's tremendous accountability. This is not meant for you to feel pressure. This is meant for you to feel like, okay, we're going to be on track really to having you achieve your goal, which is a healthy, happy baby. Up until, let's just stay with the number 20. Again, if you do 10 treatments and I see that you are really devoted to the commitment required for our fertility program, then we may do it before 20 treatments. But let's say at 20 treatments, you're ready, like really ready to do what it really takes. By 20 treatments, you would know, okay, I really like Anna's program. If you don't hit the 20 treatments yet, if you're not there yet, or if it's been more than 20 treatments and you feel like, okay, what's the difference? I'm still going to give 100% to every patient coming in for fertility. There is a screening process now. It's been a while, but there's a screening process for fertility patients to come in through the door. We want to make sure that my methodology and my philosophy for fertility matches yours. You should have already watched the 11th video. This video is the introductory video that tells you if you want to, I break down certain things to help you understand, okay, I do want further information. I do want to work with Anna. The first 10 videos were all about getting, especially the first 9 videos were about natural fertility. The 10th video is Anna's 30 pieces of advice for fertility. It's an hour and 2 minutes. It's a very long video, and I recommend that you watch it in pieces and frequently and really understand what I'm asking of you to do, which is basically reprogramming a lot of behavior and thinking process, your mindset. If you go to elementsinharmonyacupuncture.com, you'll see that, again, you'll see that I broke it down in several sections. One of them is specifically fertility, pregnancy, and birth. And from 99 to 2006, just to reiterate, I took all fertility cases. 2007, I did not take any fertility cases for a year. 2008 until last year, 2019, I focused only on natural fertility. In 2019, July until now, I have taken the responsibility of all fertility cases. That's a long story that I explain in other videos. I have found, again, that since opening my practice up to patients who do not focus on natural fertility, that there's a time frame that they're on, not on the time frame that Mother Nature's on. I'm not going to discuss that all here. This is a one-on-one conversation. I do want to share a few things. If by the time your 20th treatment comes and you're doing all of my suggestions, but slowly, you're doing the treatments not exactly how I intend for you to do them. You're not taking the herbs exactly the way I intend you to do them. You're not doing the Qigong. You're not following the proper mindset. You may then be ready to take the next level. What people see on social media, what people see in my emails and my newsletters are my success stories. I'm very proud to share that I have had a tremendous success record with natural fertility from 2009 2008 until 2019, when I only focused on those. I asked for 6 to 12 cycles, 12 to 18 cycles, or 2 to 3 years. The women who did exactly what I asked them to do got pregnant with a full-term pregnancy with healthy, happy babies. Um, Behind me, those are a few case studies. Those are not my number of babies. You see a few pictures. I'm very proud of those pictures. I have more pictures, more emails, and a lot more testimonials that were sent to me via text that I didn't even post. With my making the exception since July 2019 in accepting non-natural fertility patients, I've had even more success. Yesterday, my first 5 patients, yesterday was Friday, today is Saturday, my first 5 patients when I opened the door were my 5 mommies, 4 of them pregnant, one of them who had natural fertility success stories. We had 2 babies together, a 3-year-old and a 17-month-old. She's not trying anymore for fertility. She said, don't get me pregnant, I'm just here to sleep, because she has a 3-year-old and a 17-month-old. The other 4, one of them's natural. I asked for 6 to 12 cycles. She got pregnant in the 12th cycle. We had a lot of work to do. The other 4 were IVF, I believe. And one of them, 73 treatments, and I described that in my 12th video. My 12th video is IUI IVF video with acupuncture. That I explained. She was the patient that came 73 times between August 2019 to August 2020 to get pregnant. You see the level of commitment even for my Western fertility patients. Why am I creating Anna's fertility program? Well, it didn't just happen. I've been creating it since 1999. This has been in the works for 21 years. When people ask me, why don't you specialize in fertility? My specialty is helping people graduate from pain and suffering. The reason why my natural fertility patients got what they wanted, a huge portion of them, I often said I had a 90% success rate, is because they followed the program. They followed my guidance. They listened. When I asked for people to give me 6 to 12 cycles, 12 to 18 cycles, 2 to 3 years, there's a reason why they achieve their goals. They may have done IVF, IUI with failed trials. They might have gotten pregnant, but they had miscarriages. These women might have had abortions. They might have had multiple miscarriages. They might have sold some of their eggs when they were younger. They might have, been abused. There are many, many reasons why women come in. And then there are quite a few that have inexplicable infertility. So I just want to let you know that Anna's fertility program is for discerning fertility patients. It is not free, it is not cheap, and it's going to take time, and it's going to take a lot of personal growth. So I just wanted to get that out of the way, because I don't expect a lot of people to sign up for this program. The non-Anna's fertility program is just basically the treatments. I follow you, I give you guidance, I hold your hand, I give you 100% of me, I tell you exactly what to do with the acupuncture, exactly what to do with the herbs, exactly what to do with the qigong, exactly what to do with the mindset. I give all of that, but I don't hold you accountable. I just let you do whatever you want to do. And one thing that I've noticed is I set myself up for success. If you watch my 12th video on IVF on IUI, I really spell it out so people know exactly what I expect. Now, what I'm noticing is that when I advise women specifically for IVF and IUI, that I want to do a minimum of 6 months, minimum 3 months, but at least 6 months. And if it's less than 3 months, they need to come 3 times a week. If it's at least 3 to 6 months, I want you to come 2 or more times a week. I notice that women come in and then they want to change the game plan, and you want me to follow your timeline, and it's okay. I will do that. But I want you to ask yourself a question. Um, how is your way working so far? So I will do exactly what you asked me to do. You want 100% from me, I will give you 100%. And I'll follow your timeline. But you're not, you want the best out of me, but you want me to do what you want me to do. This, and I will do that with the non-Anna's fertility program. I hope that my words of advice and my experience count for something. When I say I see the track record and what people are actually accomplishing, whether it's endometriosis, PCOS, whatever menstrual issues they have, they're not ovulating. I have a picture up there of a mom who, the week before she told me she was pregnant, her doctor told her, there's no way you can get pregnant. You're not ovulating. I asked for 6 to 12 cycles. She got pregnant in 7 months. I was in my time frame. When women follow my recommendations for natural IUI or IVF and they follow it to a T, and they do the herbs, and they do the Qigong every time, and they follow the mindset, guess what happens? There's a reason why yesterday I must have had 26 patients. The first 5, just the first 5, not including later, were my mommies, my current mommies, and then one of them with the 2 kids that I helped to get pregnant. And then later in the afternoon, I got a phone call, a text. Anna, I'm pregnant. Thank you. I want the world to know that no, I don't specialize in fertility. And I don't ever plan on saying that I specialize in fertility. I practice Chinese medicine my way. I want it done the right way. I want you to get pregnant the right way. I share in my videos that my job is to not get you pregnant. My job is to make your health perfect so that you become a perfect baby palace, so that you have a full-term pregnancy and can deliver healthily a healthy, happy baby. My end result is a healthy, happy baby. I don't want to just get you pregnant. My timeline is Mother Nature's timeline, not your timeline. So when women come in and they agree to everything and then they start changing the plan, okay, you know, I've given you the referrals to see other people. You don't want to see them. I've given you the best advice that I can give you, the best advice that you're paying me to give you, but you're changing the recipe. I have 3 babies. I had them at 30, 36, and 43. I know what I'm talking about, both with my patients and for myself. And I'm 46. I said it at 43 when I gave birth. If I want to have another baby, or my husband and I both got fixed because we knew we can be pregnant again. At 42, I said, if I want to have a baby right now, I can. And boom, without trying even. There are things that I'm going to share in our program. It's going to be about an hour up to 2 hours consultation. Again, this is for patients who've been with me at least 20 treatments. If I see after 10 treatments that you're very gung-ho, then we can discuss it before the 20th treatment. But after 20 treatments, I'll know you're really, really ready to go according to a different timeline other than yours. It's going to be an hour to 2 hour consultation, you and me, and it's $500. If you want your spouse to join you, whether it's your husband or your wife or your partner, there's going to be an additional fee of $100 for a very specific reason. If you can tell, I'm very straightforward these days, especially in this video. I want you to have a baby, but I want you to have a healthy, strong, happy baby, free of health issues if possible, if I can have that kind of power. I left fertility in 2007 for a reason, because women were trying to dictate to me how this medicine should be practiced on them, and I saw it not working. And I want this to work. So when I reinvented myself from 2008 on, giving all IUI IVF patients away to my colleague until he was diagnosed last year with something horrible, and I focused primarily 99% on natural fertility. These were patients who were willing to do the work, willing to do exactly what I asked them to do. And then last year, all of his patients, at least a good 90+% came here. And I still had to weed some out. I love that guy and I wanted to help with all his patients. But the people that I would not let in were the people who were in a rush, did not treat me with respect, were not having a very peaceful mindset, and wanted me to do things their way. I want you to get what you want, but it has to be we have to work together. So if you've watched this very long video so far, it's 16 minutes. This, like I said in the beginning, is not for everyone. This is not for everyone, and I'm okay with it, and I'll still give you 100%. There's no problem. I'll still give you 100% acupuncture, 100% herbs. I'll let you know what the Qigong classes are. I'll advise you on how to think, and I'm not going to force you to do anything, and I'm not going to hold you accountable to anything. That is the beauty of what I've been doing for all these years. It's so relaxed. You just do what you want, and when you show up, I'm going to be happy to see you. And if you want to take the herbs, I'm happy to prescribe them. If you show up for the Qigong, I'm happy to do it with you. If you want to follow the mindset that I advise, I'm happy to keep sharing. But if you're ready to actually, that's, to really be held accountable, why is the accountability part so paramount in the world of Anna's fertility program? Well, most, if not all, of my patients coming in for fertility are hard-working women. I've had a few homemakers, but hard-working women. And my husband and I have fertility conversations all the time. Not about me anymore, but about other people. And he's in IT, so he sees things as very black and white and logical. And he said he told me this the other day: you should advise your patients that, ask them, how long have you been doing your work? And if it's been 5 years, 10 years, or longer, are you competent at it? You probably are. You've put in a lot of time and effort into creating that level of competence. So now you want to have a baby, or it's been a few years, a year, 5 years, 10 years, and you're not accomplishing what you want. So if you want things in your life to change, you have to change things in your life. We need to change your vibration. We need to make you very competent at having babies. Both my grandmothers had 11 children. That was their job back then. Making this video right now is 2020. I was born 1973, so my grandparents were born, somewhere in the early 1900s. That was their job, was to make babies. But our society has changed all around the world, where now we're required or expected to go to school, be very intense academically, compete with each other, boys and girls in school, as young adults in college and graduate school, and maybe our PhD or medical school or dentist or pharmacy or law school. And our primary powerful years for fertility, anywhere between age 14 to 28, are not being used for fertility. So now we want to create a baby in our late 30s when everything is perfect. We have the career, we have the degree, we have the career, we have the house, we have the cars, we have everything, but we don't have the baby. And so we need to reprogram things. A few months ago, I treated a man, and he said, whenever I have sex with my wife, it's only when we're ovulating. Do you hear how sad he is? And what do I keep sharing in the Qigong classes? If you don't know, you're not going. I say to patients here and also in the Qigong class, and there are more men showing up, Don't just have sex during ovulation. You're withholding sex. I do things differently here. This is my opinion. You don't have to follow my opinions. When my mommy came in yesterday, who has 2 kids, she said the most powerful thing you shared with me, Anna, is have sex to have fun, not to get it done. And I share other things these days, a lot more powerful things that men and women can do together intimately to make their sex life more connected. It's not just have sex during ovulation. I don't even want my patients telling their husbands that they're ovulating. If you're doing it natural, or if you're doing, the trigger shots or IUI or whatever, don't tell them you're ovulating. Now, if you don't agree with that philosophy and my methodology, then this program is not for you. I don't even know if my acupuncture itself and my practice and my philosophy is right for you. That's why I try to screen everyone first before you even come in. If you want to have a strong relationship with your partner, do not, I'm talking a heterosexual couple right now, do not only have sex with them when you're ovulating. I prescribe things like go to the Victoria's Secret, go online, buy some sexy underwear. Have your partner watch this and ask what he feels about it when I say, when you go home and he asks, what did you learn from Anna from her first consultation? She advised me to be calm, relax, and stop thinking so much, to eat slower, drink warm drinks, and to let go of my problems. And she also wants me to be healthy, happy, and horny. And to stop checking my ovulation every month. When I was 43, when I conceived my son by accident, I knew I was not ovulating because my menses is by clockwork. So what was our secret? We were having fun. So going back to the topic at hand, Anna's fertility program is 1 to 2 hour consultation. I don't want to drag it to 2 hours just to drag it. If you know me, by 20 treatments, I can talk on and on and on. It'll be at least an hour, up to 2 hours. These timelines will be limited. They'll probably be at the very beginning of my day. I cannot, when I'm seeing a lot of patients, I cannot just add 2 hours to the end of my day. It has to be at the beginning, and they will be limited slots. So this is not something that we're going to rush into. This is going to be when you know you're ready. We will be holding you accountable to following my treatment protocol for acupuncture, following the herbal protocol, making sure that you're on top of it, making sure that you're eating right, making sure that you are at every Qigong class, no matter what is going on. I have kids, dude. I have 3 kids, 16, 10, and 2. When I have to do something, everything drops because I have to. That's what being a mother is about. You drop everything when you have to do something. The Qigong is an option right now for everyone. But I can tell you, when people are held accountable to their acupuncture, held accountable to their herbs, held accountable to their mindset, held accountable to the Qigong, guess what happens? The reason why you're so competent at work is because you're held accountable. The reason why you do so well in your business is because you need to get paid. Everyone's held accountable. In my work, I'm held accountable. But when it comes to fertility, people up until this point, what's today, September 12th, 2020, you do whatever you want to do. You show up whenever you want to show up. There's no accountability. And I just treat you as I treat you. I give you my suggestions and you take them. And if that's your level, I'm totally fine with it. There's no judgment. I'm totally fine with it. But for those of you who are like, okay, whatever you're doing is not working, I have a question to my family, my friends, my patients. If you're doing things and you're not getting the results, I always say, how is what you're doing working? Like, I had a patient, she said she had sex every other day for, I want to say 2 years, but at least a year. And I said, that's not how you do it. Because she said, I don't have a libido because we're doing it every other day. And it's to have a baby. It's not to have fun. It's not just to, no. You know what? If you're having vaginal dryness, if you're having pain during sex, if you're not wanting to have sex, if sex is a chore, and if you haven't followed my pieces of advice, including studying Mantak Chia, and I give you all the information, if you're not putting your feet on the ground, on grass, all this information is free. It's on YouTube. It was my 10th video. You're not being held accountable. I have people ask me questions, and I say, yes, I give them the answers, and I say, that was in my video. You may think this is too much information. Well, I ask you to watch it slowly, and we'll go over it slowly, and I talk about it slowly. But so many people want it like this. But your quick method of living is not giving you the results. When I prescribe you, go and get a hotel room, because sex in a hotel is a whole lot different than sex at home. There's a reason why. Drew and I were in hotels a lot in our early 40s. And why do you think we had a baby at 43 when we weren't even trying? Because we did it like 30 and 36. And I always let people know I have received acupuncture and herbs 1 to 5 times a week since I was 20 until 30 to make sure that when it was time to conceive, it would happen for me. There are a lot of things that we'll be discussing and how we'll be holding you accountable. It's going to feel calm. It's not going to feel pressure, but it is going to be taking fertility at our place at a higher level. You're going to get even more out of me. Instead of 100%, you're going to get 150%. I will walk you through it. This is for the discerning patient who wants to get pregnant. I cannot guarantee you a baby. I cannot guarantee anything because I'm not God. You take this on your own voluntarily. There's no refunds. Again, it's $500 to join, and then we take the next step. If you have your partner come in just to even sit and listen, it's an additional $100. That's not negotiable. If these rates change, I'll make a new video. It is at least a 6-month program, no matter what. I'm not going to guarantee you a baby. I know that's a big risk, right? It's a big risk, but by 20 treatments, you'll know if working with me at a higher level, there's going to be some stuff to do, some writing to do, some reading to do, some audios to do, and it's going to be at your pace, what you can physically, emotionally, and financially handle. But I've noticed that people who've been following my protocol have become mommies, and I want to make sure that you get 100% out of me. Some people don't need the extra guidance, so they don't need to this next level. And then some people need more of my time and energy. So therefore, I'm creating this program to make sure you get everything you want from me. And we'll discuss in full detail when you're here. Okay? So if you're ready, you already know my website, you know my number. By 20 treatments, you know how to get a hold of me. I look forward to hearing from you. If you never bring this up, it's okay, because I've shared with you the video. I want to make sure you know exactly what to expect from me. The first 9 videos are on natural fertility. The 10th video is my Anna's 30 pieces of advice for fertility. The 11th video is a video that I give everyone now to make sure they're screened before they come in, to make sure that you understand where I stand as a fertility practitioner, acupuncturist using acupuncture and Chinese herbs for fertility. The 12th video is acupuncture with IVF IUI. This video is just letting you know I have. So if what you want is Anna's fertility program, let me know and we will take the next step. All right, thank you for watching this very long video. I appreciate it. Have a great day.